Good morning from Taipei. This is Christianity and Liberty, and I'm your host, Andy McCafferty. Today, we're going to answer an important question, namely, how many healthy American grade school children have died from COVID-19? It's a very important question. It's important for parents, it's important for doctors, it's important for politicians, it's important for educators. How many healthy American grade school children have died in the last 2 years from COVID-19? I would think that the answer is easy to find. We could just surf the web, read some news sites, listen to some podcasts, and somewhere you're going to find the answer to this question. But after I searched in these various ways, couldn't find the answer. But I will tell you what I did find, and it's very, very interesting. So, let's get started. The first thing I did was to go to the American Association of Pediatrics website. Every week, the American Association of Pediatrics, the AAP, does a 35-page report on children and COVID. I give you the link in the video on my YouTube site. I read the September 21st, 2021 report. Concerning our topic, in Appendix C, there is a chart labeled Summary of Child Mortality Data from 5/21/20 to 9/9/21. And the chart reports that there are been a total of 460 cumulative child deaths. Now, this is a ways back, so there's been a few more in the last month, and they also only had reports from 45 states. This is a very important number, 460. Tragic number, but it's not our answer. Our answer is way less than this, because there's three differences between the AAP's 460 and our question. First, we are asking about children K to 6, but the AAP 460 includes all children from birth to 17. Second, we are asking about healthy children, but the 460 includes children with underlying health issues. Third, we are asking about children who died from COVID, and it seems that the AAP's 460 includes at least some children who died with COVID, but not from COVID. Okay. We need to understand these three differences. The AAP doesn't say anything about these three questions, these three differences. So, after viewing their site, I went up to the Center for Disease Control website. Actually, the Center for Disease Control has many sub-sites. They have 4 different sites that give you a lot of data about COVID. There is data.cdc.gov, covid.cdc.gov, wonder.cdc.gov, and the National Center for Health Statistics, cdc.gov/NCHS. And on the covid.cdc.gov site, we can find a table from October 1st, 2021 that answers one of our questions. It's not that easy to find, but if you search around for a little bit, you can find it. It tells us that 5 to 11-year-olds, there have been 125 deaths from COVID. So that's part of our answer. It might say it's the high end of our answer, that 125 children have died from COVID. Now, to get our answer, though, we need to consider the 2 questions which remain. The first is, this 125 includes both healthy children and children with underlying health problems. Second, it's not clear whether these kids all died from COVID or whether some died with COVID, but not from COVID. I'm going to spend a few minutes looking at both these important questions, but first, because the discussion is somewhat technical, let me give you a summary of what I discovered. There is good reason to think that most of these kids died from COVID and not just with COVID. But there's also good reason to think that at least 80, perhaps 90, perhaps all of these children had underlying health problems. First, from COVID versus with COVID. The National Center for Health Statistics explains the difference between from COVID and with COVID. They have a page understanding the numbers. And there they write, I quote, COVID-19 deaths are identified using a new ICD-10 code. When COVID-19 is reported as a cause of death, or when it is listed as a probable or presumed cause, anywhere on the death certificate, the death is coded as U07.1. So, what that means is that when they get the statistics, a death report, if the death has on the statistic ICD-10, that means the child had COVID, but not necessarily that they died from COVID. But if the report also includes the code U07.1, that means that the child died from COVID. Now, we have to ask, what was on the report for those 125 grade school kids who passed away from COVID? Well, you can't find it there, but you do find in a different place, a different chart. And it lists all of the deaths, 690,000, all deaths involving COVID-19. And then there's a footnote, footnote 1. And if you go down the page, you will find that footnote 1 states that these deaths are coded U07.1. This means that COVID was the cause of death, or a cause of death. So for the CDC's listing of 690,000 deaths, that's about all the deaths there's been to this point, they are all U07.1. And this suggests strongly that their 125 figure in a different chart is also understood as children whose cause of death was from COVID. That is, that they were marked as U07.1. However, there's always some complexity. If we look at the chart, the same chart that has the footnote 1, it also tells us that some of these deaths had multiple causes. So some of them were listed as having a pneumonia, and the important one that they give is some were listed as having had the flu. In other words, the person had both COVID and the flu. And not that many, there were 9,328. But it raises the question of whether the person died, the main cause was COVID or the flu. And it's very difficult to know. But in any case, it doesn't seem to be that many. So we can assume that most of the 125 children who died from COVID, COVID was the main cause of their death. The more important question is the question of underlying medical conditions. As far as I can tell, the CDC sites do not tell us what percentage of the children who died from COVID had underlying medical conditions. In fact, with respect to children, they write, and I quote, "Current evidence on which underlying medical conditions in children are associated with increased risk is limited. Current evidence suggests that children with medical complexity with genetic, neurological, metabolic conditions, or with congenital heart disease can be at increased risk for severe illness from COVID-19. Similar to adults, children with obesity, diabetes, asthma, or chronic lung disease, sickle cell disease, or immunosuppression can also be at increased risk for severe illness from COVID-19. Now, in adults, older adults, 80% of the deaths have been for people with underlying medical conditions, the most important being obesity. This suggests that the same is true for children. Perhaps it's more than 80% because children are more resilient. Perhaps it's 100%. The CDC doesn't tell us. We're putting together what we've said already, 125 deaths. Maybe 20% of these were healthy kids. That would be 25. Maybe 10% were healthy kids. That would be 12 or 13. Maybe none of them were healthy. That, of course, would be no healthy child died from COVID. Okay, in summary, our question is how many healthy K-6 children have died from COVID-19? The CDC explicitly tells us that as of October 1st, 2021, 125 K-6 children had died with COVID-19, 5 to 11 years old. But there are two big questions. Did these kids die from COVID or only with COVID? And secondly, how many of these kids had underlying medical conditions? The CDC does not give us the answers, but it seems from what they do say that most of the kids, if not all of them, died from COVID. But that at least 80%, perhaps 90%, perhaps all of them had underlying medical conditions. If we assume that 90% had underlying medical conditions, that would mean 10% were healthy, then the answer to our question would be probably about 12 or 13 healthy kids, K-6, died from COVID, have died from COVID. But here's a better answer. The CDC doesn't give us this number, but it's a very important number. As we talk about mandating vaccines, mandating masking, the question of how many children K-6 have died from COVID is a very important question, and so someone ought to ask the CDC what the answer is. We hope you enjoyed this show. Thanks for listening. If you want to leave a comment, you can do so on my new YouTube channel. Our plan is to do one show every week, so check back next week. I'm Andy McCafferty, the host of Christianity and Liberty. We hope you have a wonderful day. All right, goodbye.